Recognizing early signs of dementia. What to look out for. Dementia is a condition that affects millions of people worldwide, and it can be a difficult topic to talk about. It's hard to come to terms with the fact that a loved one may be losing cognitive function and memory, but it's important to recognize early signs of dementia in order to get the best possible care and support. In this post, we'll explore the early signs of dementia and what to look out for. From forgetfulness and confusion to difficulty with everyday tasks, recognizing the signs of dementia is the first step in getting help for your loved one. We'll also discuss how to approach the topic with your loved one and what to expect as the condition progresses. Whether you're a caregiver, family member, or friend, understanding the early signs of dementia can help you provide the best possible care and support for your loved one. 1. Understanding dementia. What it is and how it affects the brain. Dementia is a term that describes a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily life. There are many different types of dementia, but the most common is Alzheimer's disease. Dementia is caused by damage to brain cells, which affects the ability of the brain to communicate effectively. This damage can occur in different areas of the brain, which will impact the symptoms that the person will experience. As the disease progresses, it affects more and more areas of the brain, leading to a wide range of symptoms. These can include forgetfulness, confusion, difficulty with language, mood swings, and changes in personality. It's essential to understand that dementia is a progressive disease, and symptoms will worsen over time. However, it's important to remember that not everyone will experience the same symptoms or progress at the same rate. While there is no cure for dementia, there are ways to manage the symptoms and improve the quality of life for those affected. Understanding how dementia affects the brain and the different types of dementia is crucial for recognizing the early signs and seeking appropriate medical care. 2. Early signs of dementia. It's important to recognize the early signs of dementia in order to get an accurate diagnosis and start treatment as soon as possible. Some common early signs of dementia include forgetfulness, difficulty with familiar tasks, confusion, mood swings, and changes in personality or behavior. Forgetfulness is one of the most common early signs of dementia. People with dementia may forget important dates or events, repeat themselves frequently, and have difficulty remembering recent conversations or information. They may also struggle with familiar tasks, such as cooking or driving, and may need help with things they used to be able to do independently. Confusion is another common early sign of dementia. People with dementia may struggle to follow conversations or understand what is happening around them. They may also get lost in familiar places, have difficulty making decisions, and struggle with simple tasks like shopping or paying bills. Changes in personality and mood are also common early signs of dementia. People with dementia may become more withdrawn, irritable, or anxious. They may also lose interest in hobbies or activities they used to enjoy, and may struggle to adapt to new situations or environments. If you or a loved one are experiencing any of these early signs of dementia, it's important to talk to a doctor or healthcare professional as soon as possible. Early diagnosis and treatment can help manage symptoms and improve quality of life for those living with dementia. 3. Memory loss. Forgetting important dates, events, and information. Memory loss is one of the most common early signs of dementia. People with dementia tend to forget important dates, events, and information that they would have easily remembered in the past. This includes things like birthdays, anniversaries, appointments, and even the names of close family members and friends. At first, these memory lapses may be minor and may not be noticeable to the person themselves or those around them. However, as dementia progresses, memory loss becomes more severe and can significantly impact a person's ability to function independently. It's important to note that occasional forgetfulness is a normal part of aging, and not all memory loss is due to dementia. However, if you or a loved one is experiencing frequent memory lapses or difficulty retaining new information, it may be worth speaking to a doctor about the possibility of dementia. Early detection of dementia can lead to earlier treatment and better management of symptoms. If you suspect that you or a loved one may be experiencing memory loss or other early signs of dementia, it's important to seek medical advice as soon as possible. 4. Difficulty with familiar tasks. Forgetting how to make a meal or turn on the TV. One of the earliest signs of dementia is difficulty with familiar tasks. This can include forgetting how to make a meal or turn on the TV, tasks that were once easily accomplished without much thought. People with dementia may forget the steps involved in making a cup of tea or coffee, or they may struggle to remember how to use household appliances like the microwave or washing machine. They may also forget how to do things they've done many times before, such as knitting or playing an instrument. It's important to note that occasional forgetfulness or making mistakes when performing a task does not automatically mean someone has dementia. However, if you notice that a loved one is struggling with tasks that were once routine, it may be worth bringing up with their doctor. Early diagnosis and treatment can help slow the progression of dementia and improve quality of life. If you are concerned about a loved one, it's always better to err on the side of caution and seek medical advice. 5. Changes in mood and personality, unpredictable behavior, depression, and anxiety. Changes in mood and personality are one of the most common early signs of dementia. People with dementia often have unpredictable and uncharacteristic behavior, which can be difficult for family members and caregivers to manage. Depression and anxiety are also common symptoms of early-stage dementia. The person may become more withdrawn, irritable, and apathetic. They may lose interest in activities they used to enjoy and become easily frustrated or agitated. It's important to understand that these changes are not the person's fault, but rather a symptom of the disease. In some cases, the person may become more paranoid or suspicious of others. They may accuse others of stealing or hiding their belongings, or become convinced that someone is out to get them. These delusions can be very distressing for both the person with dementia and their loved ones. If you notice any of these changes in mood and personality in a loved one, it's important to seek medical advice. While mood changes can be caused by a range of factors, including stress and depression, they can also be an early sign of dementia. An early diagnosis can help ensure that the person gets the support and care they need as soon as possible. 6. Trouble with language, struggling to find the right words or repeating phrases. One of the early signs of dementia is trouble with language. This can manifest in a few ways, including struggling to find the right words or repeating phrases. If you notice that your loved one is frequently pausing to search for a word or using vague language instead of specific terms, it could be an early indication of dementia. Repeating phrases can also be a sign of dementia. Your loved one may say the same thing multiple times in a conversation, or repeat a story they have already told you. This behavior can be frustrating for both the person experiencing it and those around them. It's important to note that occasional forgetfulness and difficulty with words can be a normal part of aging. However, if these symptoms are persistent and impacting daily life, it's worth considering a medical evaluation. If you are concerned about a loved one's language abilities, try to approach the topic with empathy and understanding. Dementia can be a scary and emotionally difficult diagnosis, so it's important to provide support and resources for your loved one throughout the process. 7. Difficulty with spatial awareness, struggling to navigate familiar surroundings. Difficulty with spatial awareness is one of the early signs of dementia. This means that a person may struggle to navigate familiar surroundings or may get lost in environments that are new to them. They may also have difficulty judging distances or recognizing familiar objects. For example, a person with early dementia may struggle to find their way around their own home or may become disorientated when driving to a familiar location. They may also have trouble with tasks that involve spatial awareness, such as packing a suitcase or organizing a bookshelf. It's important to note that everyone can have an off day and struggle with directions or spatial awareness. However, if you notice a loved one consistently having difficulty with these tasks, it may be worth discussing with them and their doctor. If you think that someone you know may be showing early signs of dementia, it's important to encourage them to seek medical advice. Early diagnosis can be essential in helping to manage the condition and provide support to the individual and their loved ones. 8. Losing track of time, losing a sense of time or getting lost in familiar places. One of the most alarming signs of dementia is losing track of time or getting lost in familiar places. This can be a very frustrating and confusing experience for the person with dementia, as well as their loved ones. It's important to look out for this sign and take appropriate action if it's noticed. Forgetting appointments, not knowing what day it is, or losing track of the season can all be early indicators of dementia. Losing track of time can also manifest itself in getting lost in familiar places, such as forgetting how to get home from the local grocery store or becoming disoriented in a familiar neighborhood. If you notice these signs, it's important to seek medical advice as soon as possible. Early diagnosis and treatment can make a huge difference in the progression of dementia, so don't delay in seeking help. In the meantime, there are things you can do to help your loved one cope with losing track of time. A daily routine can help establish a sense of structure and familiarity, while using calendars and clocks can help with keeping track of appointments and time of day. It's also important to ensure that your loved one always carries identification and contact information in case they become lost while out and about. 9. How to differentiate between normal aging and dementia. As we age, it is normal for our cognitive abilities to decline slightly. However, it can be difficult to differentiate between normal aging and early signs of dementia. There are some key differences that you can look out for to determine whether your loved one may be experiencing something more serious than normal aging. Normal aging may cause some forgetfulness, but individuals are usually still able to perform daily tasks with ease. Dementia, on the other hand, can cause significant memory loss and confusion, making it difficult for individuals to complete regular daily tasks such as cooking, cleaning, and dressing. Another key difference is the speed at which these changes take place. Normal aging occurs gradually and slowly over time, whereas dementia symptoms may appear suddenly and progress quickly. It is important to be aware of other signs such as personality changes, loss of interest in hobbies or activities, difficulty with speech or communication, and trouble with spatial awareness. If you notice any of these signs, it is important to seek medical attention as soon as possible. Remember, early detection is key when it comes to dementia. By knowing the differences between normal aging and dementia, you can help your loved ones get the care they need before it's too late. 10. When to see a doctor and what to expect. If you or someone you know are experiencing any of the symptoms of dementia, it is important to see a doctor as soon as possible. Early diagnosis and treatment can help manage symptoms and improve quality of life. During your visit with a doctor, they will likely ask you questions about your symptoms and medical history. They may also conduct cognitive tests to evaluate memory, language, and problem-solving skills. In some cases, they may order brain imaging tests to rule out other conditions that may be causing the symptoms. It is important to bring a family member or friend to the appointment who can provide additional information about any changes in behavior or memory loss that they have observed. Don't be afraid to ask questions and take notes during the appointment, as this can help with understanding the diagnosis and any recommended treatments. If a diagnosis of dementia is made, the doctor may prescribe medications to manage symptoms or refer the patient to a specialist for further evaluation and treatment. The doctor may also recommend lifestyle changes such as a healthy diet, exercise, and cognitive stimulation activities to help manage symptoms and slow the progression of the disease. We hope that you found our article on recognizing early signs of dementia helpful. It's important to understand what dementia is and how it affects people, especially as we grow older. Early diagnosis can make a significant difference in managing the symptoms and providing the right care to the person affected. If you or a loved one are experiencing some of these signs, please seek medical advice as soon as possible. Remember, it's never too early to start taking care of your mind and brain health.